Hello friends, so today we will be revising ophthalmology. So revising retina in 5 minutes. So starting with the retina pigment epithelium, it is composed of macrophages. It is macrophagic in nature. This is very important question. Now rods. Rods are green in color. These colors are asked that rods are green in color. This is a very important question. Now rods are maximum in 20 degrees. 20 degrees to what? 20 degrees to fovea. Rods are maximum in number in 20 degrees. Now rods present in fovea. Rods are present in fovea, but they are absent in foveola. So they are absent in the foveola, but they are present in the fovea. Now the outer plexiform layer, it comprises of what so the fibers, what fibers of molar and Henle's layer. So it comprises of outer plexiform layer is comprising of fibers of molar and Henle's layer. Now indirect ophthalmoscopy or gonioscopy is used for what? It is used for peripheral retina to visualize the peripheral retina. Now optic disc is a blind spot. This is a very easy point, but important to remember. Now we will talk about the retinal detachments. Now, so first of all, the first one, rhomatogenous retinal detachment. Some important points in this, that it has a V's ring, solitary ring like vitreous opacity. So it is a vitreous opacity like V's ring, it is called. Also the second point, you can remember that black curtain like defect plus the convexity in the nature. This is now the second one, retinal detachment. Fractional retinal detachment. So young age, it occurs. The most common cause is due to age disease. When the old age, the most common cause is diabetic retinopathy. Also it is concave in nature. Now exudative retinal detachment. So melanoma and associated with melanoma and VKH syndrome, also shifting fluid sign is seen in exudative retinal detachment. This is very important, so remember that. Now diabetic retinopathy, the what are the important points to remember? Microaneurysm is seen, dot blot hemorrhages are seen, hard exudatives are seen, and cystoid macular edema CME is seen in diabetic retinopathy. This is very important and you have to remember this. Now central serous retinopathy. Central serous retinopathy, what are the points you should remember? So ink blot, enlarged dots, and now smokestack pattern, mushroom pattern, you have to remember in the when the diagram also is coming nowadays. So smokestack pattern, elevated retina, so ring reflex, this is called ring reflex, elevated retina, and central serous retinopathy. So these are the points important to remember in this. Now retinitis pigmentosa, so it is the points to remember: sporadic, now waxy pallor disc and bone spicule pigmentation is seen, arteriole attenuation, and golden metallic tapetal reflex. These 4 points are very important and you have to remember all of them because they ask the exclusion and accept type of things. Also two more points to remember: it has a female carrier and it has a tunnel vision. So this is very important in retinitis pigmentosa. Now cherry red spots, some very important conditions where cherry dot spots are seen. This is directly asked as a MCQ man nowadays. So Tay-Sachs disease, Niemann-Pick's disease, CRAO, and it is very confusing, CRAO or CRVO. So CRAO is responsible, and it is cherry red spots are seen in CRAO. Now Faber's disease, Gaucher's disease, GM1 gangliosidosis, and metachromatic leukodystrophy. So seven important diseases disorders I have to find for you for this. Cherry red spots are seen in which one? So remember this and learn this. Now retinoblastoma, so Knutson's, remember Knutson's hypothesis and the chromosome number 13q and 14. Now leukorrhea is the most common sign. The calcifications are cottage cheese like seen. This is very important. Spread is like spread it optic nerve. Now source are photoreceptor cells. Now the features are Flexner Winterstein Homer Wright rosettes. This is very distinguishing feature of retinoblastoma and associated with osteosarcoma knee. This is very important and very much asked nowadays. Also, what triradial retinoblastoma is, there's bilateral retinoblastoma plus pinealoblastoma. So these are the very important things you should know in the retina. You can revise it in 5 minutes. Also, more sessions like this will be coming, so stay tuned and you can comment what else I can add. Thank you.